Where do we draw the line between parental rights and child abuse? I'm going to change around a lot of details to protect this patient's privacy, but a colleague of mine recently treated a child who came in breathing hard and fast, drinking lots of water and urinating very frequently, and blood work showed a lot of acidity and that it was filled with ketones, suggesting a diagnosis of diabetic ketoacidosis, which is a severe and life-threatening complication of type 1 diabetes when insulin is not being given. This was the child's second visit for the exact same reason since their diagnosis a month ago, and the parents admitted that they purposely weren't giving the child insulin because they didn't trust big pharma or the healthcare system. Unfortunately, this kind of distrust is becoming more common. It started with vaccines, but now we're starting to see parents refusing to give their children life-saving medications like insulin for type 1 diabetes or inhalers for severe asthma, all because of a belief that these therapies only exist to benefit doctors and pharmaceutical companies. My colleague had no choice but to involve Child Protective Services, and I would have done the exact same thing. When we see cases like this, we first need to understand whether this is simply a lack of knowledge. Like, do the parents actually understand what the disease is? Do they understand that before insulin was discovered, children with type 1 diabetes routinely died at a very young age? And do they understand that without treatment, the repeated hospitalizations are predictable and preventable medical emergencies? Because once you've explained all of that, like once the parents know that effective therapies do exist and they still choose to withhold them, their beliefs about doctors and big pharma stop being harmless opinions. They become decisions that puts their child's life in real danger, and that's when it crosses the line. But what are your thoughts?